Hi everyone, my name is Karen Ling and I'm an occupational therapist that will be talking to you about diabetes and physical activities today. As you know, losing weight and exercising is a difficult task. It's something that doesn't come naturally for a lot of people and sadly myself included. But to find that motivation and what drives that person is really the key to exercising continuously. And that's exactly what we're here to talk about and explore today to help caregivers such as yourself to understand the fundamental concept of how to input more physical activities in your care receiver's daily life. Okay, so we're going to start with a little activity where you're going to just sit where you are and close your eyes. What we're going to do is that I'll be asking you 8 questions, and in between each question, I'll give you a moment to think about your answers. You don't have to write your answers down. All I want from you is to really think about them and maybe even keep track of how many of those questions you can answer with confidence. Okay, so the first question is, what is the name of your care receiver? Second question, what age range is he or she in? Third question, did he or she grow up in the US? If not, where? Fourth question, does he or she have any siblings? Fifth question, what is his or her hobby? Sixth question, what is his or her preferred color or style when it comes to clothing? Seventh question, is he or she a cat person, a dog person, or an exotic animal person? Last question, what makes him or her smile or laugh? So how many of those questions were you able to answer? 2 out of 8, half, or all of them? The point of this exercise is to show that it really doesn't matter whether you're a hired caregiver or a family relative caring for a loved one. It's really important either way to remember the person that you're caring for, not just their names and their diagnosis, but who they are as a person. What are their likes and dislikes? Having a person-centered care will create a trusting and empathetic bond between you and your care receiver. The activity that we just did was designed to remind and initiate you to start thinking about your care receivers and who they are as a person. If through the exercise you realize that you actually don't know too much about your care receiver, that's okay too. It's really about you beginning to learn more about them. Ask them some of these questions the next time you see them in an appropriate and respectful way, of course, and then maybe try to build this bond slowly to show that you care about who they are deep inside. Okay, so before we talk about how having a person-centered approach can relate to increasing physical activities, let me talk briefly about what diabetes is and how it relates to weight. As you know, there are 2 types of diabetes, and the one that we're focusing on will be type 2, which encompasses 90% of all diabetes cases and is often diagnosed after the age of 40. There are a lot of risk factors for diabetes, but the most common reason is because of overweight or obesity, which makes weight gain as the number one risk factor. Increased weight has a negative effect on our cardiometabolic health, and for many people, weight loss can be a struggle because it requires a substantial change in our eating and exercising habits. So how does all these information relate to you as a caregiver? Well, since you're most likely the person that will have frequent interactions with the care receiver, what you can do is to have an open discussion and conversation with them about the risks and perhaps even find a time to do some light exercises together. Some of the complications with diabetes is that it can lead to or partnered with any of these listed illnesses. Our health is not usually very clear cut, so as we age, our health can get very complicated. Some can have diabetes mixed with arthritis, a little bit of depression, and maybe even cardiovascular issues. Diabetes is usually very easy to ignore because most of the time you're feeling fine until something bad happens. This is why staying active and exercising is really important. But with multiple complications, sometimes it can be hard for care receivers to stay active and stay motivated. By being inactive, it can lead to more doctor's appointments, more hospitalization, more use of medications, and spending more money on medical bills instead of fun things. So now the true question is how, right? How to help someone be motivated, and what is the key to staying active? And before you jump in and have all these fun and new activities with them, it's really important for you to have a conversation with them first. To encourage your care receivers to spend some time on thinking about the true reason why they want to get in shape and all the different ways their life can potentially improve once they do. It's really important for this to be what they want, because if not enough time or consideration is put into why they want to exercise and why they want to stay active, then eventually down the line they'll feel forced and not have that internal drive to continue and keep going. So what we've been talking about in terms of motivation has been this term called internal motivation, where I suggested you to have discussions with your care receivers, asking them questions, and really finding that deeper reason. But along with internal motivation, there's also something called the external motivation. Motivation and consistency work best when both internal and external motivations are present. And some of the examples of external motivations are activities like creating an exercise log, which will give a visual evidence of achievement. Finding an exercise buddy. So this is where you or their friends can come in and join. Finding a balance of things to do. So do cardio exercises, but also some muscular strengthening, and maybe add a little bit of endurance or balance exercises from time to time. And the fourth one is, what if they get bored? So when boredom occurs, try to mix up the routine a little bit. Keep it fun, interactive, and engaging. Using some of these techniques will allow your care receivers to get an idea of their likes and dislikes. They will begin to be able to look back at their accomplishments over time and even begin to see a pattern of which days are especially hard for them to work out as comparing to other days. It's important to find activities that you can do outside so you could enjoy the fresh air and be part of the environment. But it's also really important to find activities and exercises that you can do indoor in case for bad weather. This way, you can still exercise and stay active even if the weather is bad outside. Keep in mind though that this whole process takes time, and it's all about making it fun while staying true to the internal reason for staying active and healthy. If you're interested, I'll also be talking about the different types of exercises for seniors with and without limited mobility in other videos. Thank you so much for watching this one. I hope you find the information helpful, and I'll see you around. Bye!